Hey you guys, welcome back to the Spill Podcast. I am your host, Vivian Rose. So in this week's episode of the podcast, I had a guest on here. Her name is Sudi, and she is the sweetest woman ever. She shared her story on her health story and her mental health journey and how she recovered from trauma. And she is giving us multiple tips and just going through her whole journey and telling us how and teaching us about trauma, depression, all things mental health. So if you want to learn about mental health things and get a little bit more on her journey, then stick with the episode. I will not be doing my usual segments because I really want to get straight into the episode. It is absolutely incredible. You guys are absolutely going to love it so much. So let's get right into the episode. Hey you guys, so I'm super excited to have this person on my podcast. She is absolutely incredible. She has been through literally so much, and I'm just so honored to have her on my podcast. So you can go ahead and introduce yourself.
Hello, everyone. My name is Sudi. Nice to meet you all.
Thank you.
Yeah, go ahead.
Oh, no, you go ahead. I'm sorry.
Yes, looking forward to chatting with you guys and giving you as much feedback about my background as well as my journey.
Yes, we're so excited. So let's go ahead and get started. I know that you've been through a lot of health trauma and a lot of different trauma going on health-wise and in the hospital. How did you mentally continue through that? Like, can you give us your story and how you got through that time in your life?
Honestly, it was tough. It was not an easy journey because there was no infrastructure ready to be there for me, right? Because a lot of times when you get massive, serious medical conditions come suddenly onto you, where you're diagnosed with an illness that you previously did not have, such as there are illnesses where you're born with, illnesses that gradually evolve, and then there are sudden illnesses like a heart attack, right? So these sudden illnesses really shift your identity as well as your reality. And a lot of times the healthcare systems are not prepared for dealing with that emotional, psychological aspect of the illness. So they're more about the physical. Let's treat the physical elements. Let's do surgery. Do you need to do cardio rehab? In my situation, that's what I needed to do, 3 rounds of cardio rehab. But the other aspects of my regaining my wellness, that there was no infrastructure. So I sort of had to figure it out myself. And now that I've been post surgery, almost 2.5 years, going on to 3 years, I can really look back and say, wow, this is all the stuff I wish I had that now I can help other people in that journey. So one of the things that was lacking, especially for me, I'm in Canada, is that in the Canadian healthcare system, although it is free, they don't really have a mental health component in dealing with it. Obviously, in the hospital, there's a psychologist, psychiatrist come and help you digest your diagnosis. But beyond that, oftentimes when you do seek their assistance, they'll tell you, you know what, this is completely understandable. You've been through a lot, considering the information you've received about your current health conditions, but time will pass and you will adjust to it. That is not very comforting. So that's where I was at, and I had to navigate it myself. I had to advocate for myself, and I had to really build my own roadmap back to recovery, reconciling my identity previously as a healthy, fit person that was very conscious about their wellness, and then a person that automatically, almost overnight, was a patient for life. I'm a heart failure patient now. I'm a stroke survivor now. There's all these new identities that I have to reconcile with. And then having no infrastructure of how to do that, I think that delayed my recovery. And I know that it delayed a lot of other patients that I speak with in their recovery. So oftentimes when 2 things happen. One, the person cannot reconcile this big shift and they go into depression, where they're just like, you know what, if this is the life that I have to live now, this is not the life I want because this is not who I am, right? So they almost have imposter syndrome to their new reality, and they kind of feel like they're in a twilight zone. They're like, this is not real, this is going to pass, or if this is the choices I have been left with, why me? Why did this happen to me, right? So they get trapped in that cycle of constantly rejecting their health circumstances. And that's very harmful because that prevents you from healing.
Yeah.
Because healing cannot happen when you're in constant state of stress, psychologically, physically, emotionally. You're resisting something that you cannot deny, right? It's your, for example, somebody who had a leg amputated due to a medical condition, for example, diabetes. They'll often have a phantom limb syndrome where they'll try to walk and then it takes them a while, sometimes months, for them to be like, okay, I know myself in my mind, I have a leg. But in reality, now I do not have a leg. So I cannot pretend to deny this new thing that I'm immobile. Mobility has been compromised permanently for life. So, yeah. So, and I think a lot of veterans deal with this issue, but that's really what I had to go through. And now that I've been able to do that, and a lot of the way I was able to do with that, it was a lot of self-work, inner child work, compassion, gratitude of what I did have left. I was a new mother. I was still alive. There was still another day of healing ahead of me where, imagine I just had passed away in the hospital. Those options would not have existed. My chapter and my story would have ended there. So focusing on the brightness of the journey and the amazing doctors and nurses and caregivers that were there and the family and friends that were championing me to recover, that's really what got me through it all.
Yeah, that you have been through a lot. I just want to commend you to keep going and stuff like that's just incredible. I'm just so in awe because that's just incredible how you changed your mindset and how other people, they'll be like, this is just how it's going to have to be now, but you completely shifted your mindset and you took it upon yourself to realize that I want to keep going on. And like you said, you were a new mother and stuff. That is just incredible. That is incredible.
Oh, thank you. And honestly, when you're going through it, it does not feel incredible. It feels painful. You feel like you've let yourself down. Everything has let you down. But so to really foster that resilience and courage within yourself, it takes a lot of self-work. And I really help people navigating that because if you don't, put yourself in a predicament where everybody doesn't see what you're going through, right? You have an invisible condition. For example, for me, I had a heart attack, right? And I had heart surgery. But after I got discharged to the world, I looked okay. Like I'm still here, I'm still talking. But these are invisible wounds. And oftentimes what limit us from prospering in our health journeys is the lack of acknowledgement that we ourselves have as well as our family members have, because they have a certain expectation of you're that sister, you're that friend, you're that parent, you're that, so many roles that we play in life that somehow we're expected to still continue to play, but now we're not those people. Like we've shifted. It's like imagine you're an actor, you've been given a role, but later you come back to play the role. Everybody expecting you to do your monologue, but imagine you don't speak the language anymore. And everybody's like, huh? You're supposed to do this. This is what you've been put in this position to do. But you're like, I have memory loss, And that happened to me when I had my strokes. My vision was compromised. I went blind temporarily. I went deaf temporarily. And then the impact of the strokes. So it felt like that. Like I was an imposter to my own reality of the life that I had built up to live. And then now I couldn't because I have all these other challenges that I now have to reconcile, like I was saying.
That's really scary. I'm so glad you made it because then you wouldn't be able to live the life that you wanted to. I'm just so happy that you made it because that sounds like a lot to go through, not just physically, but mentally. I know it creates a lot of trauma inside of you. And that actually leads into the next question. How would you describe trauma and what it does to us?
Oh, wow. Trauma robs the individual of joy. That's really, in essence, regardless of what form of trauma an individual goes through, in essence, what that person has been robbed of a peace of mind. Mm-hmm. So that for me, that's, if I could capture it in just such small sentences, that's what I would say. And when you talk to people that have so many different kinds of traumas, so it's not something that is generic label that everybody could use, because it is so individual. The way two people could be in the same car and get into an accident, but the way they're affected physically, psychologically, emotionally, is permanently lasting difference. Because even your recollection of the reality of that you went through this event is different, will change in time. Sometimes you'll have flashbacks. You're like, what? Like you have new synapses in your brain. You'll have stress, muscle cramps. There's so many ways that the person stores trauma in the body and in the mind, that you can't. There's no way that you could just generalize trauma as an umbrella that covers everybody's experiences. And I think that's why trauma work is so hard and it's so difficult to navigate, because even if the experts, the psychologists and the psychiatrists, people that have gone to get credentials in supporting individuals in these journeys, cannot effectively do it without acknowledging that I cannot walk your shoes. I cannot help you address emotional things that are so minute and so personal and have a historical context, because everything is within context. And when you try to remove things out of context, you just say, oh, talk about it, write about it, and visualize it. That is very difficult to do, because it doesn't acknowledge the subconscious capacity of your mind to store all these things, right?
Mm-hmm. Yeah. I completely understand that. Like, they can try to help you as much as they possibly can, but at the end of the day, they didn't go through what you went through. And that makes a whole lot of sense, because they do go to college and stuff for that, but they can't walk your shoes, like you were saying, on what you've been through. Well, can you explain to us, like, how would you recover and try to heal from trauma?
Oh my goodness, I have a whole course in this. It's very difficult. And the reason it's so difficult is because first we have to go outside, have like a third perspective on the context that it happened in, right? Mm-hmm. Once you have context of how it all happened, then you have to put yourself in a way that you're not emotionally triggered to process it. And there's a way to do this. And that's how I was able to do it for myself. And I help other people do it. Once you do that, then you have to chip away, like you would train a muscle, to say, today I will only accept this level of discomfort, right? Mm-hmm. Because if you say, I'm going to take everything on, I'm just going to stew in the feelings and the emotions and the events that happened, you'll go into shock. Your body will literally go into shock. And sometimes the shock that it goes into is not visible to the person who's going through it. This could like present itself in insomnia, body tension and body pains, other illnesses, like it'll exacerbate to another illness. Then you're dealing with that illness and dealing with, like, oh, why do I have now an autoimmune disease? Oh, now why do I have joint pains? But underlying all of that is the trauma that's still locked in the body, right? Mm-hmm. So once you do that, and then you have to look at the people and the context that this all happened in, and you have to pick out supporters in that journey. And then that is quite a process. I don't think it's something that we could encompass in this conversation, but I would say it takes time, but the time is not encapsulated in like days or months or something. It's sort of like a mind thing where you'll get to a point where your mind, you don't even realize that it changed. Like things that triggered you don't no longer trigger you. because you always do the emotional work on it.
Mm-hmm. Yeah, when you went to like your doctors and hospitals, did you have to go to multiple different doctors to get help?
Oh yeah, because one, I had to go see like a neurologist for the strokes and the events of that. Then I had to go see a cardiologist for the heart and the heart attack.
Mm-hmm.
And then I had to go see other doctors because of the even in cardiology, there's different layers of specialization, right? Mm-hmm. So initially, I was seeing an intensive cardiologist that only specialized in LVADs, which is a left ventricular assist device. Mm-hmm. It's a device that is basically artificial heart in essence. It takes over the pump of your heart. It doesn't. You don't have a pulse. You don't have a heart rate like your heart doesn't palpitate. It just frozen there in your body. So then I was under their care for a while. Then I saw. Now I'm seeing a heart failure cardiologist. It's a different specialty in the cardiology journey. So it slowly evolves the physicians you'll be interacting with in any health circumstance, right? Mm-hmm. But what really is difficult is that all of these doctors are all in their own silos. They all have their own specialization and they don't directly communicate with each other. So oftentimes you have to go from one doctor, go to another doctor and explain where your communication was with the previous physician or specialist. And that is also traumatizing too, because you just have to explain, I'm sorry, I know you're telling me to get on these medications, but these medications or these things will counteract everything else I'm doing, you know?
Yeah.
So, and then what they'll do is they'll do like internal referrals, but those referrals take months to really work through them. And you're constantly advocating for yourself, like, no, this is what I need. This is what my body needs. This is how I need to heal. And so if you're not advocating yourself, what often happens, you get trapped in this, going from one doctor to another doctor, and you spend years in that cycle.
Yeah, that makes a lot of sense because my mom, she actually has celiac, and they didn't know what it was at first. They sent her to neurology. They sent her to like multiple different hospitals, doctors all around our state, and they still couldn't find anything. And the one who actually found out what was wrong with her was just her normal doctor she goes to see every year, and none of the specialists could help her. So I completely understand because I was right there with my mom, and I really get that.
Mm-hmm. Yeah, thank you. Yes, and I think that's a lot of times you just sort of think the healthcare system is all intergrained, but it's just many parallels working in the same journey. So each one is sort of has blinded to what another discipline's work is. And oftentimes that's where the family doctor comes in to make the connections and communicate in between and also propel your self-advocacy work, like while you're getting this diagnosis or while you're trying to heal from the ailment.
Yeah, because that one doctor, that's not even his specialty. He's just there to do the basics. And the issue that she had, that was a specialist job, but they couldn't even do that. And that one doctor who helped her, he went out of his box and helped her. And I just feel like it's so good to find a doctor that will actually go out of what they specialize in to help you. And I completely understand it's very hard to find doctors who know what you're going through. Yeah.
Yeah, yes, that's so true.
Okay, let's get into depression. So can you explain to us what is depression and how it affects our brains?
Oh wow, that is such a big question.
You don't have to go too deep into it.
yeah, it's just your mind is very powerful, right? So when the mind is, if we go from the position of the mind is very powerful, the mind perception of reality is fluid. So oftentimes it could be physical, emotional, psychological elements that will see the mind into thinking there is nothing left for you, like there's no hope. And can you imagine waking up and being told, in a hypothetical, like metaphorical sense, that you're in a room, there's nothing in that room, and somebody comes in and tells you you will never leave this room. You know, that shock of like, what? What do
Yeah,
you mean?
that's
When
scary.
you had a full life. Yeah, so the mind does that to you when in depression. So it takes away all your hope, aspirations, and oftentimes because your sense of reality is compromised, it is very hard to work out of. And a lot of times the specialists that are supposed to be there to help you go through it or support you through that journey, they themselves have never gone through it.
Mm-hmm.
So they're giving you information and anecdotal research data of how to get through depression. But for the person that's in it and that's living it, it doesn't make sense. Like that is ineffective, to say the least.
Yeah. Yeah, I get that because I went through a depressed period and it really is scary and it feels like no one can help you because you feel so far in and I completely get that. Yeah. Can you
Yeah.
yeah, can you can go ahead.
No. I was waiting for you.
Okay.
Just acknowledging your statement. So true.
Yeah. How does isolation make depression worse to you?
Well, you know what? It depends on the person, right? So
Mm-hmm.
some people, they're introverts, and some people are extroverts, right? And a huge group of people are both. So when you're in that isolation, what happens is that there is no break. Your negative self-talk that's keeping you in the depressed state perpetuates, and there's no break from it because you are alone with it all day, right? But when
Mm-hmm.
you are not in isolation, you interact with other people, even when it's like temporary. Like I know it's temporary, but you get ideas and communication with an outsider, like an outside human being or an outside body, and that those brief moments where you have a break, it allows your mind to rest and think of, oh, actually, I have hobbies. I actually have things that I enjoy. Not everything is bad, right?
Mm-hmm.
So, and then those brief moments of that thinking uh, ignite the motivation and the relax your muscles and your mind, like your brain as well, uh, to to make new synapses, like new healthy connections within itself to get you out of the depression.
Mm-hmm. Yeah. How would you go about um, trying to get on the road to recovery from depression?
It is very difficult. It is very difficult because it is so person specific. It's not something that I could say for do A, B, C, D, and you'll be out of it, because the context of why it initially happened and the suppressed emotions that initially caused it to happen needs to be first addressed.
Mm-hmm. Yeah, and I get that. Yeah, because what you just said is what a lot of people learn in therapy. How a lot of people are different, and it really depends on how you got into it in order to know how to get out of it. Yeah, that makes a lot of sense. Can you explain to us the courses that are available on your website about building courage and stuff? Hello. Yes, I can hear you now.
Oh, perfect. Thank you.
Mm-hmm.
So yeah, so what I created is, and I think I have to put it in context of why I was able to do this. It's because previously, prior to all of my health events, I was a social worker
Mm-hmm.
for a decade. I ran a nonprofit organization, and in that, I helped people navigate from serious traumatic events. And I'm talking about newcomers, refugee populations that were in war zones that came back and came to Canada, where I'm at, and they had to now reconcile all the things that they've just suppressed because they were in a state of war, right? And
Mm-hmm.
then when they come here, they have to go to the doctor. Normal life, like daily routine things would happen, and then they would be triggered, and they wouldn't know how to emotionally deal with those events, and they wouldn't know how to advocate for themselves. Like I had one patient, a client of mine, where she late when she came to Canada, she learned that she had gun uh, fragments in her body,
Wow.
and in her brain, and then there was not operable because the way how it was situated. So, and now she was disabled. But she's like, when I came to Canada, I wanted a new life. I wanted to just leave that life behind of the events and the painful journeys that I've gone through. But here she was now with physical disabilities from the poisoning or the poison coming from the fragments. And I had to help her navigate that. Like, what does wellness mean to you? How do we deal with it? And then I had to do it for myself when I found out that like the healthcare system was not going to really address these issues. And the way I worked through it, the system that I used, and I helped those individuals, is how. So basically, I created a course that is guided path to helping the individual create their own recovery map. Like, I'm not going to tell you, do this and you're going to get fixed. I'm going to actually walk you through the whole process. And then we're going to test the different things that we could do, we have available to us in terms of support system, resources. And from that, we create a roadmap back to recovery. It takes time, but it is achievable. And I think a lot of times people lose hope because they're like, well, for socioeconomic reasons, I cannot afford a therapist. My therapist is not effective because or for those that could afford it, they've been going for years and they haven't found a solution because there's a disalignment between the therapist's ideology and the patient's, the client's ideology. So once you reconcile those things and the person knows their moral compass, their framework, their historical context, where they came from, how things happen, you could then see the solution. It's like, think of trauma as seeing snippets of a movie and then being told, now make up a story. You can't really do that. You have to know this whole story of the movie, then say, oh, now I know how that movie ended, right?
Yeah.
You can't make a conclusion of the ending of the movie when you just saw a 2-second trailer that only gave you one event in the movie, you know? And the mind encapsulates that event into trauma in the mind. It traps it. And then that's the little snippet, like that 2-second or 2-minute narrative keeps replaying in the mind and imprisons the mind.
Yeah, and you teach all of this in your course?
Yes.
Wow, that is well worth the money. Seems like you teach a lot of stuff, and it's cool to have somebody who teaches you that has been through a lot too, so they can kind of be in your shoes.
Yeah, because I don't have the burden of trying to be an expert, right? All I'm here to offer is that I've lived through it. I know many, many, many people that have lived through trauma and serious medical events who have been given very poor prognosis and recovery. But guess what? They're all here and they're all thriving. What is getting them there, you know? And how could we use that to create one for ourselves?
Yeah.
So I'm more about the empowerment, encouragement of self, the belief that you are capable of transforming your reality. And a lot of times, like even for myself, like a lot of people won't believe it, but when I had my heart attack and I went into heart failure, I was given 3% survival because my heart function was at 3%.
Wow.
So scientifically, there is nothing to explain. Why am I here? Why am I still alive? I don't know, you know? So that's really that's the purpose that I feel like this is my purpose to share, because medically I shouldn't be here.
Yeah, that's crazy. You had 3%? Wow.
3%. Yeah.
Wow.
And I have the scans and everything. Like, you'd only see one little piece of my heart function, and all the rest, everything else has shut down.
Wow. That's crazy. And if you guys want to purchase her course and to check it out, it'll be in the show notes down below. So just click the link in the show notes and you'll go to her website. You'll find all her blog posts. She has lots of cool things, so go check that out. So next is, what are your favorite ways to practice self-love or self-care?
Oh, honestly, everybody's different. But for me, what I really love is travel. I love to travel. So even in the pandemic, when I couldn't travel, I was doing like local within which would be like for you a state within your state, and also a lot of spa days at home, reading. I picked up painting, like all these little things that just sort of gave me little joys, right? And then
Mm-hmm.
I went really into skincare. I'm very passionate about skincare. So I did a lot of that, healthy eating, and spending time with my family. So we couldn't do anything in the pandemic, right? So a lot of us had to come up with new ways to fulfill our needs for adventure.
Yeah.
And I think adventure really fulfills me, and the sense of planning and a getaway or things like that. Yeah.
Yeah, I love to travel. It's so fun to see a different environment than what you see every day. Yeah.
Yeah, and also planning it is also a fun, because it's like, I don't know, it's like reliving it twice, because first you plan it and you know you're going to really enjoy it, then you go and you enjoy it, then you come back, you have all your pictures and memories, and then it's sort of, I don't know, it's constantly rewarding itself. It's a cycle of reward.
Yeah, planning it is just as fun as going.
Yeah, and honestly, this could be the same for a lot of activities. Like some people don't enjoy traveling because they have fear of heights, or just it's not their thing. But it could be knitting, or it could be cooking and finding that recipe, cooking it, enjoying it with your family, and having feedback from the family members or your loved ones that how much they enjoyed the recipe. And like, I think creative processes, in essence,
Mm-hmm.
are very healing, and that's one of the things that I really often take part in whenever I feel like I'm not feeling my best.
Yeah. Do you have any? I heard you said reading. Do you have any book recommendations?
Oh yes, I do actually. Thanks. Yeah. So my favorite book that I find, especially when it comes to like trauma and stuff, is Dr. Kabor Mate. He's a Canadian physician and has a lot of training and experience in trauma. Has gone through his own trauma. So one of the books that he has is When the Body Says No. So oftentimes, especially as in women and men as well, but predominantly for women, I think, because we're much more inflicted with this challenge where
Mm-hmm.
we feel something's happening in our bodies and we just kind of ignore it. We just think it's going to pass, or we have an ache and we sort of say, oh, we're too busy to go make a doctor's visit or investigate this a little bit more. So he really talks about how you first listen to your body, and your body is your first warning signal that you should be taking care of yourself a little bit more.
Mm-hmm.
So that book, When the Body Says No, is really one of my favorite books.
It sounds like a great book. I'm gonna have to read that.
Yeah, it's an enjoyable read too. It's not a very dry scientific book, so I think you would enjoy it.
Okay. Now, is there anything else that you wanted to add about mental health or your story or anything?
No, I would like to hear about you a little bit. Like I know that the community knows you so well. You're the go-to person, but you and I, we're just connecting today, and I would like to get to know you a little bit about your story and how you got to the starting the podcast, and how's that journey has been.
Well, thank you for asking. So a lot has happened in the past few years, especially during the pandemic when we were kind of like alone a lot. That's when my depression had like a lot of its peak, and it was hard for me to really talk to other people because of course you're at home all day every day, so all the people like my friends and stuff, I couldn't go talk to them. I had to talk to them over the phone, and it's just not the same as talking to them in person. And when I finally started like my YouTube channel and I started my podcast recently, it was such a nice way for me to be able to talk and not always have to have a person there. Like, I'm able to give my advice and my viewpoints on different things because I've been through depression and I've been through like really bad anxiety, and I'm so glad, but I don't have celiac. I just have like a really bad gluten intolerance, and a lot of people go through that as well. So I'm able to share my story about that and how like it really it makes a toll on your digestive system, and it's really hard for you to choose different foods and stuff. And so I'm just so glad that I'm able to share different things like that and through my podcast and just help as many teens, young adults, women as I possibly can. So yeah, I really am glad that I get to do this.
Yeah, and you know what I love about that is it's an outlet, and I think that's also why I created and I requested to, send to be interviewed at your podcast, because a lot of times just sharing the journey is therapeutic, and knowing that there's millions and millions of people in the world, and your wisdom and your perspective is valued. And oftentimes when we're just we don't share it, like thank God for like platforms like YouTube and the podcasts that allow us to share, because then we can make connections with like-minded individuals, right?
Yeah. And that's incredible. Like, I love different businesses and different shows and podcasts when people actually have a story to tell and they actually can give their wise words and advice for it. Like how you do that with your blog and stuff. I just love that. I read, like, I want to say maybe 5 of them, and they're just incredible.
Oh, I didn't even know that. Thank you.
Yeah, I love it.
I just feel like I'm just this one little person on the internet. Nobody was checking for me. So I appreciate when somebody says that. Thank you.
Of course, it's incredible. Like I'm super into psychology. That's what I'm studying, like in college and stuff. And so I'm just like, it just really like broadens what I learn in psychology. It's really good to see it from somebody else's point of view than just school. So I just loved it.
Oh, thank you. I would love to come back on your podcast, because I just feel like we're both all about sharing the journey, and I feel like there's sometimes just getting feedback that somebody else has gone through that, because I have gone through depression. I've gone through anxiety after all of my health events, and I love hearing about other people's journey of how they heal, because I'm not here to claim any kind of expertise. Like, I don't want to be an expert in a particular arena, because once you do that, when you say that I'm an expert, you kind of dismiss the opportunity to grow and learn from other people's wisdoms, right?
Yeah. Yeah.
Awesome.
This was so fun. Thank you so much for coming onto the podcast. We definitely got to do this again.
Definitely. Thank you. Have a beautiful day.
Thanks.
Bye, community.
Bye. Thank you guys so much for listening to this week's episode. You can find all things Sudi in the show notes down below to find all of her links to her blog, her social media accounts, everything in the show notes. Just go check and click it and follow her on all of her social medias. And thank you again so much for being on here. I had so much fun. And please feel free to leave a review and rating over Spotify and Apple Podcasts. It really helps the podcast to be shown to more people and help more and more people around the world. And I appreciate you so much for listening, and I will see you next week. Bye.